Main purpose of the doing dental implant is to preserve the bone structure once you lose the tooth. A lot of people have a misconception of replace missing tooth, but the number one reason you do that is to preserve the surrounding bone that supports the adjacent there. Because once you lose the bone in that area, start losing, and then not only it affects the teeth adjacent to it, everything starts shifting towards that empty space. So now it compromises your appearance and then also position of your teeth, so that it affects how you eat. By putting dental implant, the dental implant stimulates the bone around it, so it preserves the bone structure. Therefore, you maintain that space for a long time. That's the number one reason that we place the dental implants there. Here in our office, dental implant is the best option that we can offer to our patient to replace your missing teeth. So the bridge, commonly called it a bridge or the fixed partial denture. Basically, we have to use, when you're missing the tooth, conventionally how it was done was you have to use adjacent teeth. We have to grind down your healthy teeth, and then we take the impression and then we replace those missing teeth. But negative side of that is once you start grinding your teeth, the life expectancy of your teeth, it's reduced by half. The reason for the bridge to fail is because you can still get cavities under the bridge. So now, instead of replacing one tooth, now you got to replace two adjacent teeth. So we could have done dental implant, for example, without damaging adjacent teeth. Now, many years later, now you end up replacing 3 teeth or 4 teeth or more. So that's why dental implant has advantage to it, because it doesn't damage any teeth next to it. Here in our office, dental implant is the best option that we can offer to our patient to replace your missing teeth.